Washington, and to the congregation. I'm glad to be back. We did this a couple of months ago down at Christ Church out on a rainy day. And it was pretty cold, and people came out, and we had a great time in that rally. And here we are again, and looks like things have not changed much. Thank God for all of you who are here. And there was an article, you might have already seen it, and I said this might be providential because as we get ready to try to get back to Ridge and all of these other senators and Congress people, and this article is, it says, a steep rise, health spending increases rapidly, largest one-year climb since '60. And that ought to tell us, and that should tell them something. And then the article goes on to read, and it ends on page 86, of how important healthcare reform is. And they take no sides, they just deal with the straight facts about why we need healthcare reform, because it's about to break the nation the way healthcare is rising. I'm on the board of University Hospital, and we are in the throes now of the Health Alliance being dismantled, and we're fighting that battle with Jewish and Mercy. And it's ugly. It's real ugly. Christ Hospital just lost the suit, $100 million for that damnable thing that they did. It's ugly. Healthcare is just ugly every way you turn. It's ugly, ugly, ugly. For those of us who are pastors and spiritual people and leaders, our congregation, our congregants, our parishioners, we need to be vocal, and so we can help them to try and get some relief and some remedy. And we've been fighting this battle for quite a while, and this is nothing new for many of us. We've been on the front line. And in recent days, people of faith have raised their voices in the healthcare reform debate and started talking about moral values. Yeah, many have wondered if this is appropriate or even helpful in such a technical policy discussion. Well, for those of us who are black preachers, African American preachers, we've never had any problem with our values or our morals, because we always felt that the church was the focal, it was the place. You just mentioned when you were a little boy. I was already about half grown when you were a little boy, but when King and Abernathy and Andy Young and Hosea and all those guys used to come here, I was the guy who went to the airport to pick them up, bring them to places like Lincoln Heights, where I was raised, and Lincoln Heights was the mecca of civil rights in this city. And even before Fred got here, Moss was here, and we had some tremendous guys. Then Lane showed up, and then BW and JW Jones and all of us, and so I had my teeth cut. I started preaching when Avondale was burning, and back in 1967. And that day that I preached my first sermon, Dr. King was at Zion Baptist Church, delivering the message on his way to Riverside, the church in New York. And this was the second Sunday in June 1967. He stopped by, and Booth put him up that morning, and he preached at Zion Baptist Church. So values have always been what we were about. And one of the values is health for all of God's people. Healthcare, number one, access to good healthcare is a right and not a privilege. Jesus healed those who came to him without regard to who they were and to any profit. And this is why I'm so upset with a whole lot of these TV guys who go around and claim to be faith healers. And You got to go to them, you got to give them money. Jesus did not charge to heal folk. He went to the pool of Bethesda, and Bethesda means house of mercy. And he went to all of those places. And did you know that just about every hospital in this city, except the one that I'm on the board of, University Hospital, is named after some Bible person or somebody in the Bible? Christ Hospital. Yes. Yes. Now, I mean, how you going to be Christ Hospital and put the name of Christ out there and don't, oh man, embody the values of what Christ was about? How can you call yourself Bethesda Hospital, and it was Bethesda where the man was laying there for 38 years and couldn't get in the water? Yes. And it means mercy. Yes. Deaconess, all biblical. Yes. Yes. And so we need to think and wake up and start letting our voices be heard. It's too much people going around not doing anything, and we're doing stuff in our individual churches, and we're having rallies, but health care is not dead. So number one, access to good health care is a right and not a privilege. When we are instruments of bringing about good health, Sister Mary and Spencer, we do the work of God. The gospel stories of Jesus healing people, of restoring people to physical wholeness and full participation in their community, always signal God's presence. And I want you to know, as a society, we must make the shift from seeing health care as a privilege to understanding health care as a basic right for all of God's children. Everybody ought to have the right to health care. This H1N1 stuff, I just found out the other day, it was a whole lot to do about nothing. And we almost went broke with H1N1. And I found out that after you a certain age, you build up an immunity to H1N1 anyway. Amen. And a whole lot of folk were just going around, and a lot of money was just wasted on something that was about nothing. So maybe I should have told you that. United we stand. Don Spencer, divided we fall. The division between those who can afford adequate coverage and those who cannot is a threat to our unity and a threat to the health of our neighbors and our nation. 46 million people in our country are uninsured. Millions more have insurance, still can't keep up with their bills. Our moral and religious standards say that no one should be left out of a system simply because they cannot afford to pay. It's crazy. It's crazy. Because they can't afford to pay. Rock, I know you'll be talking in a minute, but you see, number three, patients, not profits. No one should be discriminated against in their health care because they are sick. Our current health care system does exactly that. How in the world? I mean, the whole thing is about do no harm. Do no harm. That's what the Hippocratic Oath is all about. Amen. Of course, we who are black, we know who originally was the man who invented medicine. We know all that. But that ain't the part why I'm here tonight. Although it's Black History, that ain't why I'm here. Let's give it to Hippocrates. Okay, he did it, all right? Do no harm. But there's a lot of harm being done to folk who are sick. If I'm sick, I need a doctor. I don't need for somebody to turn me away because I'm of a different hue, or I'm of a different ethnic, I'm of a different